Yeah, let's get into before we go into supplements, let's go into just a couple of things we're going to be looking at from a functional medicine testing perspective, things that we may see red flags on that would help clue us in. So, specifically, I'm thinking about just infections as a whole. We talked about mycoplasma already. So, we're probably going to be looking at possibly virus, bacteria, parasites, candida. I mean, there's a lot of different gut infections and then systemic infections that could be huge. I mentioned Lyme briefly. So if you have migrating joint pain specifically, that may clue us into something like Borrelia. So you may need to get a full, Lyme tick-borne co-infection panel, a viral panel, a bacteria, parasitic panel, and then gut infections can play a role too.
So in general, anytime there's some type of gut inflammation, that can easily emanate, especially if the history is a chronic history for pain, the gut always has to be ruled out. Okay. The adrenals have to be ruled out. Another reason why the gut could be a problem is guess where all the nutrients to build back up your tissue and cartilage comes from, right? It all comes from your gut, all of the amino acids, right? The collagen amino acids, the proline, the hydroxyproline, the glycine, all of these expensive tissues that are avascular, like connective tissue like cartilage, tendons, ligaments. These tissues are avascular. I mean, they don't have a great deal of blood supply. That's why using some of these technologies may accelerate the healing when there's damage done to avascular tissues. Tissues like muscles, they're more vascular, they heal faster. So like your issue with your neck is probably a muscular issue. It'll heal a lot faster than if you had a whiplash injury from a car accident. That may take 6 to 8 weeks. So that's why it's important to understand the history of it, because that can guide us into how long things may take to heal. But when it's chronic like that, all those nutrients from the gut have to get absorbed there. And of course, things like omega-3 fatty acids may be used supplementally. We may use things like systemic enzymes, lumbrokinase, peptidase, which will be taken away from food to help digest inflammatory mediators and cytokines. We may also use things like liposomal curcumin. I have a product called Curcumin Supreme that's liposomal. Why is that better? Because about 15% of curcumin is absorbed in a powder form. So when you liposomal it, you get about a 6 to 8 time increase in absorption. So, just because you take it, you have to absorb it, assimilate it, and utilize it. So a liposome can be very helpful for that. Other things could be boswellia / frankincense, topical or internal CBD can also be used. And I would even say white willow bark, which is the main constituent of aspirin, which is acetoacylic acid, acetylsalicylic acid. That's basically your aspirin, and that's going to be your white willow bark. And so we can do that at high doses too. Do you want to add some more things to the list?
I do. So California poppy could be great. Like, let's say you don't want to go on an opiate. California poppy could be something. I mean, it technically is in the, they can make opium from California poppy, right? So you could do tinctured versions of that. And
Correct.
I'm a big fan of trying to implement some of the herbal muscle relaxers too. So like valerian root could be used, chamomile could be used, passion flower could be great, lemon balm. So extra magnesium can be helpful. So I think integrating some of the stuff that Justin's mentioned with the systemic enzymes and the anti-inflammatories, like your boswellia, maybe some ginger thrown in too, and then you combine it with some herbal relaxers like your passion flower, your valerian, motherwort may be helpful, although that's typically more nervous system related. Topical magnesium, like we've played with some magnesium creams and magnesium gels and stuff before. Float tanks like Epsom salt baths on steroids. Those are flotation tanks. Those can be huge.
100%. Those are great.
It is a hell of a protocol. And then at the same time, of course, we're running the functional medicine testing because like Justin mentioned, okay, let's say you're doing like, oh, I found this fancy organic bone broth protein powder. It's like, okay, great. But you've got H. pylori, you've got no stomach acid to even digest and do anything with those amino acids you're getting. So we can give you these Band-Aids we just mentioned, but then it's always working backwards to fix what led to the digestive disruption,
100%.
which led to the inflammation from the malabsorption in the first place.
100%. I 100% agree with that. And you mentioned magnesium, you mentioned kind of natural muscle relaxers that can be helpful. And then of course, there's other topical things we can incorporate like cold laser therapy. There's certain frequencies that can be very helpful for that. And also red light. I have a Juve light, right? Juve is awesome because it has the red light therapy, which is more superficial, but it also has the near infrared setting on there, which will allow deeper penetration for inflammation reduction. And you can just, stand 4 to 6 minutes away and get about 4 to 6 inches away and get about 10 to 15 minutes of treatment on that. And that's going to be phenomenal to help that inflammation. So the Juve is amazing. And you can go to justinhealth.com/Juve and get access to that.
Cool.
I think it's justinhealth.com. So I think it's a red light. We'll put the link below. So if you guys want to look for some of the things we're talking about, you'll have access to it below.
Okay. Yeah. I went into the sauna the other day. I've got the near infrared bulbs inside of my sauna as well. So I kind of turned around and let those lights hit my neck and hit my back. And I can't say it was a magic cure, right? But it definitely helped. And, I did do a 90-minute massage as well. And that was helpful. But some things they just have to work out of your system. You know what I mean? So in my case, this is more of just a weird one-off situation, but in a more chronic situation, yeah, I think all these other tools would be helpful. And then, of course, you always have to have a plan of what's next, meaning, okay, you take the magnesium, but then what? Because that's not just the only thing dysfunctioning. There's probably a whole systems approach that you need to look at. And that's what we love doing. We love finding and getting all the puzzle pieces laid out in front of you. So if you're somebody who is struggling, you've been through the conventional orthopedic route, you've done the cortisone shots, maybe it's the migrating pain. You haven't thought about how your pain starts in the morning in your left elbow, and by the end of the day, it's in your right knee. I mean, these are things you need to look at. So if you need help clinically, that's what Justin and I are here for. And we can achieve all of this virtually. There's no need for an office visit with the type of labs we're talking about. For example, that mycoplasma thing that we did on my wife, Justin wrote up the requisition form, sent it to my email. I print it out. We go to the lab, get the blood draw. You go home, you get the answers, you get the protocol done over the phone. It's easy. So there's really no limit to what we can do. We live in a great time right now with virtual practices being able to help so many people in such a deep way.
100%, man. I totally agree. And we're on the same page. And there's a lot of options out there today, which is amazing. It's not just go to your doctor, take these medications. They may have side effects and they may also ignore the root cause. Now we actually have information out there that really gives people a chance to choose, what's the best option for them. And also they are educated behind it. They're making a more informed decision, which is great.